Now, when it comes to fighting COVID, it's all in the numbers. This week, hospitals and states will stop reporting patient information to the CDC. That information will now go to a private contractor hired by the feds. Here's Reveal investigator Andy Parati.
Critical COVID-19 information no longer directly reported to the nation's leading health agency.
And I have to say, it mystifies me why we would do that.
Dr. Kamara Jones is the past president of the American Public Health Association and a former CDC scientist. From the start of the pandemic, the agency collected COVID-19 patient information, ICU bed availability, and other information directly from hospitals through the states. That's no longer happening. Instead, states will now report to a private contractor called Teletracking, hired by the Department of Health and Human Services.
It's just made harder for us to really know and manage and appropriately deal with this pandemic. It is a threat to the health and well-being of the nation.
Not so, says CDC Director Dr. Robert Redfield. Last week he wrote, "No one is taking access or data away from the CDC. We have merely streamlined the data collection mechanism for hospitals on the front line." White House Press Secretary Kayleigh McEnany.
I did confirm that with Dr. Redfield, that this is completely open source data available to the CDC. Secretary Azar says we insist that they use it, and no one, and Dr. Redfield confirmed this, no one is taking access or data away from the CDC, and that data is routinely published so that the American people are fully informed.
HHS awarded a $10 million contract to Teletracker in April to collect the data, which has drawn criticism from some lawmakers because it was given without a competitive bidding process. U.S. Senator Patty Murray of Washington tweeting, "The Trump administration is going to have to give a full justification for this."
Who knows what this other group is? Where did they come from? Why was it a no-bid contract? Like, it is so mysterious.
The White House says the new reporting system increases the number of hospitals reporting COVID-19 information. Jones says the change is another example of politics dictating a response to a public health crisis.
So what it's doing is it's undermining again our public health infrastructure in this country in the midst of this pandemic. And that can't be good for the health of the nation.
The Georgia Department of Public Health confirms it will continue to publish its COVID-19 hospitalization data, as will other states. We reached out to Teletracking for an interview, but did not get a response.